we appreciate you being here today and your leadership in this movement. So, just like Kathy was saying, I'm going to very quickly talk about the plan to build the movement for CalCare in 2023, and then after that, we're going to dive right into our panel. So, I'm going to move fast here. So, in February of this year, we announced, we like numbers, we announced a 5-point plan to build the movement for CalCare. And as Kathy said, the plan was, kind of came out of an analysis of the last fight for AB 1400, and from discussions across the movement that informed, what we needed to improve going forward. And I'm very proud. I think that this movement is led by nurses like Kathy. Nurses, like many of us, they're seeing what's wrong with our healthcare system every single day, and they know better than anybody what needs to happen to actually address those issues and fix it. But we also know we can't do this alone, right? Nurses can't do this alone. This campaign really draws its strength from the fact that it is a grassroots movement of people all over the state. So this plan that I mentioned, the 5-point plan, has, again, 5 components. The first component here, the first component is that we are setting out to build our biggest field program ever, and grassroots organizing is a very key part of that. It's part of how we bring new people into the movement. It's how we show elected officials that the public is with us. And we kicked off this effort with a statewide weekend of action in March of this year. We had 50 canvassing events on one weekend all across the state. I know many of you participated in that. And we've been doing regular canvassing weekends every month since. This past weekend, we just moved past 100 total canvasses this year on CalCare across the state. So that's tens of thousands. None of this would have been possible without our district leaders, our CalCare district leaders, which is a very committed group of community leaders and activists all across the state that our union is supporting with training and resources to lead the fight for CalCare in their assembly districts. On top of the canvassing effort that's been led by district leaders, they've had dozens of legislative visits with members of the legislature. They've helped get 47 candidates and elected officials to take the CalCare pledge, which commits them to doing everything that they can to fight for CalCare and to advance the movement. And our district leaders meet with one another on a monthly basis to share information, share ideas, and coordinate action. So I just want to give a shout out to our district leaders. If you're a district leader, please stand up right now so that we can acknowledge you. So the second part of our plan has been to broaden and deepen our coalition, and we deeply appreciate our allies in the healthcare justice movement, and we recognize that we need to expand the movement to include new organizations and people who have not been involved before. So to date, this year, we've had over 80 organizations across the state endorse the campaign. And the campaign also convenes a monthly organizing table for all of these organizations to coordinate with one another and plug into the campaign for organizations that are active on this issue. And of course, another key part of this coalition is other unions, and this is reflected in the third part of our plan, which is to build support in the labor movement. Support from the labor movement is essential to getting CalCare passed, and that support needs to include commitments to actually working towards passing the legislation, not just endorsing it, right? And so to this end, we've been, CNA has been meeting with central labor councils across the state. We've been answering questions. We've been presenting to union locals. And this has been really well received. We've had a number of different unions and labor councils come on board that were not previously so. My own labor council, the San Diego Carrillo County Labor Council, endorsed the campaign a few months ago. And so these are groups that have not been active on single payer before. So we're very proud of that work, and that's a big focus moving forward. So the fourth part, 4 out of 5, the fourth part of our plan is to create a robust education program that builds and solidifies support for CalCare and to inoculate against attacks that we know are coming from our opponents, right? Disinformation. And this effort is moving into full swing this month. We're working with members of the California Nurses Association, nurses all over the state, we're starting a Nurses Speakers Bureau where nurses are learning to really speak publicly on CalCare and to practice, defending it from different attacks and answering questions. And this is a group of nurses who are going to be able to go out and speak confidently about CalCare in different formats around the state. So number 5, this is the last point, and this is why we are all here today, is to organize with and within the legislature. I think we all know some legislators are allies with whom we can work. Some might be supportive of CalCare in principle, but might need reassurances, they might need questions answered about the bill, and others will definitely need to be pressured to get on board, or at least worked around, right? And we know that some elected officials are not with the people and are not going to ever support CalCare. So, we don't want to paint all elected leaders with the same brush. We need an intelligent and strategic approach to working in Sacramento. So this work has been led by our excellent government relations department in collaboration with Assemblymember Carrillo in Sacramento. So, we want to continue to engage with supportive legislators who are on our side and who, will need to work with effectively to advance CalCare through the legislature next year. We know single payer is the right policy. We know it's well past time for us to guarantee healthcare as a human right, just like every other major country, just like Kathy was saying. But we shouldn't underestimate that this is a huge transformative piece of legislation that we're trying to pass, right? It's going to require us working in tight coordination with our elected leaders who are on our side, like the folks here today, to get this done. And so that is all to say, the town hall today is part of the 5th pillar of our strategy. So without further ado, let's get into our conversation and kick off a productive dialogue this year. So I'm going to say, when we fight together, we can win. I want you all to say, we can win. When we fight together,
we can win.
When we fight together,
we can win.
When we fight together,
we